When we eat, food is broken down by our digestive system into nutrient molecules that are then absorbed through our digestive tract for use by the body. Foods containing carbohydrates or various sugars are broken down into glucose. Glucose is an important source of fuel for many organs in our body. However, to be able to use the glucose for fuel, the glucose molecule must first enter into the cell. The pancreas produces a hormone called insulin, a chemical messenger essential for the entry of glucose into cells. As the blood glucose levels rise after a meal, insulin is released into the bloodstream and sets processes in motion to trigger the removal of glucose from the blood to enter into the cells. In type 2 diabetes, the cells become resistant to insulin and ignore its message to absorb glucose. This is known as insulin resistance. In addition, in type 2 diabetes, the pancreas is unable to produce the greater amounts of insulin needed to trigger these resistant cells to take in glucose from the bloodstream. The most notable symptom of diabetes is frequent urination and excessive thirst. Other symptoms include weakness, drowsiness, and blurred vision. These are caused by chemical imbalances in the blood related to high levels of blood glucose. About 1 in 4 people with type 2 diabetes are unaware that they have the disease. It is important to catch diabetes early. Over time, high blood glucose damages the blood vessels, which can damage the organs.
Type 2 diabetes is a condition in which your blood sugar level is too high. After you eat foods that contain carbohydrates, chemicals in your small intestine break them down into single sugar molecules called glucose. Next, the cells lining your small intestine absorb the glucose, which passes into the bloodstream. When the blood reaches your pancreas, beta cells inside the pancreas detect the rising glucose levels. To reduce the glucose level, your beta cells release insulin into your bloodstream. As the blood circulates through your body, the insulin and glucose exit the bloodstream into your tissues to reach your body's cells. Most cells of the body have certain receptors on their surface that bind to the circulating insulin. Insulin acts like a key in a lock to open up the cell so that the circulating glucose can get inside the cell. Now your cell can use the glucose to produce the energy it needs to function properly. If you have type 2 diabetes, either your pancreas does not produce enough insulin, or your body's cells resist its effects, or both. If you have insulin resistance, your insulin cannot unlock the cells to let glucose in, because the locks, called receptors, are abnormal or missing. As a result, glucose is locked out of your cells. Consequently, the amount of glucose builds up in your bloodstream in a condition called hyperglycemia. To compensate for hyperglycemia, your pancreas produces more and more insulin. Your overworked beta cells try to keep up with the demand, but gradually lose their ability to produce enough insulin. Due to hyperglycemia and the lack of insulin, you may experience the following classic symptoms of diabetes: excessive hunger, excessive thirst, increased urine volume, and unexplained weight loss. Symptoms of type 2 diabetes that may appear over time include fatigue, recurrent infections, changes in vision, itching, and tingling or prickling sensations in your skin. Life-threatening complications of type 2 diabetes include diabetic ketoacidosis, hyperosmolar hyperglycemic non-ketotic syndrome, and hypoglycemia. Kidneys are a pair of about 12 centimeter long, bean-shaped organs. They lie at level of your waist on the back side of your body. Every human being has two kidneys, which lie on the right and left side of the spine. The kidneys produce urine. The urine flows from the kidney through the ureter to the bladder. The bladder passes out the urine through the urethra. Kidneys have three important functions. They filter harmful waste products from the blood and drain them out via urine. They balance the level of fluids and salt in the body. They produce hormones. Chronic kidney disease occurs when there is a change in the structure or function of the kidney. An infection, damage, tumor, or side effect of certain medications can cause kidney diseases. A kidney disease often has great implications on health and the functioning of the rest of the body. If you're suffering from a kidney disease, kidney failure can occur. In that case, your kidneys are not able to filter waste products and fluid adequately from your blood and extract them from the body. When the kidneys don't function properly, you might have the following symptoms: fatigue, nausea and loss of appetite, skin itching, high blood pressure, difficulty in concentrating, difficulty in sleeping or excessive sleep, shortness of breath. If the kidney functions can't be restored and both kidneys fail, then dialysis is needed. It is necessary if the function of the kidneys is less than 10%. The function of your kidneys will be performed artificially. There are two major types of dialysis: hemodialysis and peritoneal dialysis. In hemodialysis, your blood is filtered through a dialysis machine outside your body. In peritoneal dialysis, a dialytic fluid is flushed through your abdominal cavity, extracting the waste products from your blood. An alternative for dialysis is kidney transplantation. You get a healthy kidney from someone.